Mr. Teodoro Padilla, Executive Director of the Pharmaceutical and Healthcare Association of the Philippines, fellow advocates of universal healthcare, friends. Thank you for organizing this important forum and for inviting me to speak before you today. Unfortunately, I will be elsewhere this day. Without the superpowers needed to be in two places at the same time, I decided to take my remarks to somehow participate in the discussion. Among the most important measures of the inclusiveness of a country's economic development is public access to healthcare. All development, in fact, should be about human development. In this regard, present democratic trends offer us both an opportunity and a challenge. The democratic trends shows a large surge of young Filipinos. The opportunity here is what we call a demographic sweet spot. While neighboring countries have aging populations, ours will progressively be younger in the coming years. That means more young Filipinos will be entering the workforce, enabling the economy to expand at a faster rate. The challenge here is that in the near term, we need to devote resources to educate our young and to look after their health. In the medium term, we need to see a rapid expansion of employment opportunities. Unless we do so, we will end up with high unemployment and high poverty incidence. That challenge falls squarely on the shoulders of the present administration. We do not have the luxury of time. Our people urgently need expanded educational and health services. If we fail, they will be lost. Recognizing the need for effective response to convert challenge to opportunity, the Duterte administration put together an economic program that involves scaling up public spending. That scaled-up public spending will be invested in our physical and human capital, in infrastructure, as much as in education and healthcare. In order to dramatically scale up public investments without falling into debt, it is the task of the department I lead to provide for a more robust and recurrent revenue flow. To realize this, the Department of Finance initiated bold administrative reforms among our main revenue agencies. Better collection, however, will not meet our funding needs. We need to boldly innovate on tax policy to raise overall tax effort to match best practices in the region. The renovation of our tax policy is contained in the comprehensive tax reform program we have submitted to the Congress. Because the renovation of our tax policy will support a more inclusive growth pattern, we prefer to call this Tax Reform for Inclusiveness, or TRAIN. There is urgency in getting this tax reform package enacted into law. This is the reason the market reacted positively when our legislators announced the new tax measures would be passed as a package rather than separately. It is important that the entire package is passed in a single piece of legislation. If the legislators pick and choose, financing the economy strategy of this administration will become uncertain. Accessible healthcare and tax reform package must seem to a distant concerns at first glance. The truth is they are intimately linked. Accessible healthcare requires massive public investments in building hospitals and clinics, ensuring they are properly equipped and adequately manned. The needs are large. A large portion of our population has no access to healthcare professionals. Over half of our population receives no dental health care. We have an intolerable doctor-to-patient ratio, despite the fact our schools produce a large number of doctors and nurses. We need to reorient some of our medical schools so that they are able to produce paramedics and barefoot doctors as quickly as possible. Without a robust, reliable, and recurrent revenue flow, the government cannot make the public investments in healthcare our people urgently need. This is a critical moment in our economy's emergence. At this moment, governance needs to make large investments in sectors long neglected during the period of belt-tightening. These investments can no longer wait. If we do not do things urgently, the opportunities will pass us and so much of our population will remain poor. Universal access to healthcare requires more than a health card that is useless if there is no reachable medical facility. It requires investments in the brick-and-mortar health delivery system every country should have for its people. That in turn requires real investments in physical facilities. We need taxes to make that possible. Having said all these, let me ask you for your support to push the comprehensive tax reform package. It is a package whose merits need to be fully explained to many of our people. Renovating our tax policies will be the best gift we can give the sick and the vulnerable, the poor and the marginalized. At this moment in our country's emergence, it is the best thing we can do for our people. With robust, reliable, and recurrent revenues, we can bring our economy to the mainstream of global growth. We can dramatically bring down the number of poor Filipinos. We can lay the foundation for a high-income economy to benefit all our people. I trust that all of you who desire accessible healthcare for our people will help us realize the comprehensive tax reform program. Thank you and good day.